we are getting a lot of these non-communicable diseases. In the ancient time, we had diseases that killed us because of typhoid or malaria. But now we're getting rammed by stuff like diabetes and hypertension and heart attacks. So is this on the rise? And what do you think, doctor, went wrong since ancient wisdom and now modern sickness?
Ryan, the non-communicable diseases, which typically cover diabetes, hypertension, cancers, obesity, as well as now increasingly mental health, are definitely on the rise. If we take the Indian population back in 1990, so as recent as 1990, 25% of the deaths in the country were due to the NCDs or non-communicable diseases.
25%. That means 1/4 of our population was dying because they were slapping their own selves.
Yes,
kind of, right?
yes, kind of.
I couldn't get it from my next door neighbor or my auntie or my uncle. I brought it upon myself.
Upon ourselves. And at that time, the infectious diseases were about 65% of the deaths in the country. I think medical technology, access to vaccines, a lot of awareness about some of the communicable diseases has resulted now in these diseases going down. And the non-communicable diseases, on the other hand, have been steadily increasing. In 2020, 65% of the deaths in the country were due to NCDs.
So we've gone from 25% to 65%.
In 1990 to 2020.
So the ancient wisdom of Ayurveda is now just a lovely nameplate on our board of India. But internally, we are getting sicker. And we're not getting sicker because of infectious diseases. It's these lifestyle diseases.
That's right.
I think, just to add on to what you said, lifestyle changes that we've had in the last 20 odd years, rapid urbanization, pollution, alcohol, smoking, processed food, right? And sedentary lifestyle. While, we may be aware more about our health today, but I don't think it's in our behavior, it's actually something that we are abiding by. So I think all those things are actually leading to a rapid increase in NCDs. And 7 out of 10 deaths today in the world happen because of NCDs.
So 7 out of 10 deaths in the world happen because of non-communicable diseases, which basically is you don't get it from something, you kind of inflict it upon yourself. So where do we act? Where do we act? Do we wait till we get that slap? And in your case, you're giving me statistics of death. So does a person need to wait till they die and then act? Or, I know I'm joking about something about death, but people need to wake up and get serious. So where do I get serious? Do I get serious at the first sign of a symptom? Do I get serious when I faint and fall down? So as doctors, practicing this mantra of not curative medicine, but preventive medicine, where do we start? How do we get people to get started?
If you see a symptom, it's already, in my mind, a tad bit on the later side.
Doctor, if I can interrupt you, for the layman out there, symptom, what do we mean by symptom?
A symptom is something that you feel is off. And that means it could be a pain somewhere, a discomfort, away from the normal way that something is functioned. Example, you have a pain in the gut area, or your digestive processes, right, and bowel movements are irregular. You have pain in the chest area. All of these are examples of symptoms, something that you can feel, visibly see sometimes, touch. This is what it is a symptom. And when we say you come in after a symptom, at that point, like I said, it's a little bit on the later side. Our body is actually built to be very, very resilient and therefore can compensate for a lot of the abuse.
Is that why a lot of us have this God syndrome, that we are indestructible?
Absolutely.
Therefore, we ignore the symptom?
Exactly. Or symptom, or even the path towards that, right? You sort of start getting a little bit of a niggling feeling. You know something is off. The sleep is a little bit disturbed, but you choose to procrastinate and push it out until it becomes something that's really tangible. At that point, it's a symptom. Let's take an example. One of the rising conditions in India is fatty liver. When we think about a liver transplant or liver cirrhosis, automatically most of us think about alcohol-related liver cirrhosis.
I drink a lot of alcohol and my liver goes off.
Right? Our liver transplant surgeons say these days for every alcohol-related liver transplant they do one for non-alcoholic fatty liver conditions.
So what you're trying to say is that just because somebody's smoking or drinking, in the previous time we doctors said, oh, this guy is going to get alcoholic fatty liver disease. Now you're saying even without drinking they're getting it?
That's right. Even without drinking, they're getting fatty liver conditions. That's different from the alcohol-related cirrhosis. Let's unpack this a little bit more. How a liver becomes a fatty liver is essentially due to excess carbohydrates, right? Because the first place of storage for excess carbohydrate, when it's converted into something called glycogen, is the liver. It's only when the liver's capacity to hold that excess carbohydrates is surpassed does it actually go and settle in other places. Now, when there's excess accumulation of these carbohydrates as glycogen in the liver, there are structural changes to the liver. And that can be only picked up in an ultrasound. It will not show up in a blood test or of the liver function tests. That's much, much later, when the liver has stopped compensating for this and says, I give up. And that's when the liver function test starts to be abnormal. But if you do an ultrasound, you can actually pick up the structural changes much earlier.
Doctor, for the people that don't know, what is this ultrasound?
Yeah. Ultrasound is actually an imaging technology that uses sound waves to help visualize what's going on inside your body.
But why would somebody do this?
So typically we have heard doing an ultrasound for pregnancy related.
Yes.
Right?
Look at
the baby in the womb and so forth. But what we found is the ultrasound of the abdominal region actually picks up a number of abnormal conditions in this area. So stomach, gallbladder, liver, pancreas, ovary, uterus, right? All of these get picked up in an ultrasound. Also, you could do an ultrasound
for kidney stones,
gallbladder stones. Also, carotid arteries, sometimes you do an ultrasound to be able to see.
Where is the carotid artery?
It's around here in the neck.
So the one in the neck.
That's right.
Why would we screen an ultrasound for the neck carotid artery?
This is typically for stroke.
But youngsters will be like, I'm not going to get a stroke, but we're hearing of so many people getting stroke nowadays. So if I am in the 20s to 30s, 30s to 40s, or 40s to 50s, are we doing this ultrasound or this, the checking of my neck artery and all? Who tells me to do this?
Yeah. So also, Ryan, you don't do everything for everyone at all ages.
Okay.
Right? Different people have different risk factors, different age milestones. The risk increases. So we actually can think about a combination of tests that are most appropriate for each individual or group of individuals.
Okay, got it.